kidney removal procedure. What should you do prior to kidney removal procedure? If you are taking a platinum such as warfarin, Eliquis, Geroto, or Badaxa. If you are taking warfarin, you should recheck your iron about 2 weeks prior to the procedure. If you are stable with warfarin for a few months, then and you have a therapeutic result, you might need to hold 4 to 5 days prior to the procedure. If your iron result a little bit high, then a little bit elevated, you may need to adjust your warfarin dose a little bit, then hold 4 to 5 days. If you have really high or very elevated INR or critical INR, then probably you need to fix your INR to make it therapeutic before you can plan for procedure. You may need to come back in 1 week to see if your INR improve, so you can plan for the procedure. And if your INR improve, then you might need to hold 4 to 5 days prior to the procedure. When you hold your warfarin more than 3 days, you should plan for reaching with a lobanal injection if you have a history of recurrent blood clot, recurrent stroke, and strong risk factors of having blood clot or stroke. When you have to proceed with the lobanal injection, it should give you a separate instruction when you need to start your lobanals, when you stop before the procedure, when you should resume your lobanals after the procedure. If you are taking Eliquis, Geroto, or Badaxa, you may need to check your kidney function. Make sure you have up-to-date labs. If you have your current labs more than 3 months old, in the labs within normal limit, then you may need to hold for 2 days prior to the procedure. If your kidney labs not within normal limit, if you have kidney disease and your creatinine clearance less than 50, then you may need to hold more than 2 days. When you need to hold more than 2 days, then you may need to delay to resume your Eliquis, Geroto, or Badaxa. So, your doctors who manage your Eliquis, Geroto, or Badaxa, or the anticoagulant will give you the complete instruction when you need to hold Eliquis, Geroto, or Badaxa and to resume after the procedure. However, you should check with your surgeon or proceduralist to make sure you are safe to resume your platinum medication. If you need to delay to resume your platinum medication, then you need to discuss that with your doctor who manages your platinum medication. If you have any further question, please let me know in the comment box below. Thank you. Prostate biopsy procedure. What to do prior to prostate biopsy procedure if you are taking a blood thinner medication like warfarin, Eliquis, Xarelto, Adaxa. If you are taking warfarin, I would recommend that you should recheck your INR about 2 weeks prior to the procedure. If your INR history is stable and your INR result at therapeutic, then you will need to hold for 4 to 5 days prior to the. If your INR history is not stable, your INR result is elevated, then you may need to adjust the dose and come back 1 week if needed to make sure your INR improve before and plan for the procedure. If your INR is critical, then probably you need to hold your warfarin and adjust the dose, reduce the dose, then come back in 1 week. Make sure your INI is improved so you can plan for the future. If you have to hold your warfarin for more than 3 days, then you should plan bridge with a lower injection. If you have history of recurrent blood clot or stroke and strong bridge factor for having blood clot or stroke. If you have to bridge with the lower injection, you should follow the instruction from your doctor who managed your warfarin or the anticoagulant to make sure you understand when to start the lower injection, when you need to stop for the procedure, when you should resume your lower injection. If you are taking the Eliquis, Geroto, or Badaxa, you might need to